Good morning, everyone. As Regina said, I'm going to be talking about breastfeeding today, and I'm going to be asking the question, has breast always been best? This is an expression that some of you may be familiar with. It relates to the promotion of breast milk as the best choice for newly born infants that has been around for the last few decades. It was coined really in the post-war period in 1950s when rates of breastfeeding began to decline in the Western world, in Europe and America. So it's been a term that's been used, like I said, that you all might be familiar with over the last few generations. You'll see it in maternity literature, you'll see it in hospitals, antenatal appointments, Instagram, TikTok. It's the term used to promote breastfeeding. But it's also suggesting that breastfeeding is a natural practice after delivering your baby. In the last few years, it's received some back push from people saying that it puts too much pressure on new mothers. And we have new slogans, things like "fed is best," that you might also hear and see on social media. So despite this push to promote breastfeeding as the natural best option for new mothers feeding their new babies, as it's the best form of nourishment for the baby, it's also the best option for the mother. We're told that it prevents, or women who breastfeed are at lower risks of developing ovarian cancer. It's better for the mother's health, better for the infant's health. Most of us know this now. Even formula commercials nowadays say that they mimic the nutrition that's in breastfeeding or in breast milk. So why then does Ireland have one of the lowest rates of breastfeeding in Europe? Many Irish women choose to breastfeed in the hospital, but in terms of the continuation of breastfeeding outside of the hospital, the numbers in Ireland are very low compared to other European countries. So as a social historian, I'm very interested in this idea that women are constantly told that it's natural, it's the best option for the baby. Women did it years ago, so why aren't women doing it now? So my research looks at medical literature, private writings, diaries, workhouse registers, all those fun stuff to try and gather insight about how and why women breastfed in the past. So for today, I'm going to give you a kind of overview of some of the literature that I've assessed throughout my work and give you an idea as to whether or not women breastfed straightforwardly in the past, whether it was an easy practice, or whether women were breastfeeding at all in the sense that it's projected to more modern women. So I want to bring you to the 19th century, where in Ireland, 1 in 5 babies did not live to their first birthday. In urban areas like Belfast and Dublin, this was often worse, the rates, but babies were born into poor conditions, unsanitary conditions. They had to combat diseases that have now been eradicated by vaccines. Simple things like diarrhea or viruses, everyday viruses, were particularly dangerous for newborn infants. Doctors were acutely aware during this period that breast was best, and they promoted breast milk as the best preventative option for babies. Despite that, it was not always the first option for babies, and that was for various reasons. I'm going to show you now some material culture or artifacts that I've come across. I'm going to stand here so I can see it, over my research to suggest that breastfeeding wasn't straightforward. Women did struggle with it. This up here, is this laser thingy working? Yeah. This one up here, these are sterling silver nipple shields that women were promoted to use when struggling to breastfeed. They were produced in London and advertised in Dublin magazines from the 1890s, which again suggests that women struggled with breastfeeding. Below it then, this little, where's my clicker, it's not working? Here. This little glass bottle is a premature feeding bottle. It's a glass bottle that was found on a excavation of the Portumna workhouse in Galway a few years ago when they were turning the site into a visitor center. It's an early 20th century premature feeding bottle, again, suggesting that not all babies that would have been in the workhouse had access to their mother's milk. In the middle then here, these are a bit more modern. These are from the early 20th century. These are also handheld breast pumps. These survived from a doctor's bag exhibit that I came across in the Royal College of Physicians archive up in Dublin. And then over here is a drawing from a parenting advice book from the manual from the 1870s, and it's a Charles Maw breast pump, and it's quite similar in looks, maybe not in how it is used, but it's quite similar design to more modern breast pumps. So again, all these items taken together suggest that breastfeeding wasn't straightforward and women struggled with it. Throughout the literature, the medical pamphlets, the medical instructions, like I said, parenting advice literature were popular at the time, and throughout all of it offered various different forms of support for women or suggestions for women on how to breastfeed. The most striking advice I've come across in one medical pamphlet was the suggestion for women who are about to give birth to use a puppy dog to help extract milk before they deliver their baby. So again, maybe not something we would do today, but it shows that women struggled. Medical advice were aware of the struggles women had, and that breastfeeding wasn't straightforward. Now, all of these devices, maybe not so much the bottle from the workhouse, but all the other devices, these would have been used for upper to middle class women who had resources to get advice from their doctors, had the resources to buy these products to help them breastfeed. But I want to take you now to poorer women's experiences of breastfeeding, and we're going to go to the 1830s Mayo. Prior to the establishment of the Poor Law in 1838, a commission was set up where they went around the country and surveyed the level of poverty throughout the whole country to see what kind of system they were going to set up. And this then resulted in the workhouse system that was set up in the 1830s. But in this massive report, we get a little flavor of what the everyday life was for poor peasants. And I'm just going to show you there. Okay. So I'm going to read this out to you. This was noted from the commissioners, like I said, in County Mayo. It says, occasional labor, wife, and 5 children lived in a cabin of 1 room with a chimney and a hole in the wall for the window. The roof was bad and propped up. 1 bedstead, bed of straw with an old blanket. Almost bare walls. The man was about 34 years of age, but he looked about 50. He is naked and in rags and is a living picture of a constant state of starvation. This was quite a typical view of family life in 1830s Mayo, but what's particular about this case is the commissioners go on to explain that his wife, who, as they mentioned, already had 5 children, she was breastfeeding her 17-month-old baby. Now, the medical literature at the time argued that you should only feed up to a year, you should only breastfeed up to a year, but this woman told the commissioners that she was still feeding her baby from want of solids to wean the baby onto. So she was continuing to feed the baby because she didn't have the means to provide solids. Furthermore, she told the commissioners that she was taking in a suckling fondling that day. So during this time, before the workhouses were set up in Dublin, there was the Dublin Fondling Hospital, sorry, I'm thinking of the museum in London, the Fondling Hospital, where orphans and deserted children were deposited to from all across the country, and if they were young enough, they were sent out to country wet nurses, like this woman in Mayo. So this woman is telling the commissioners she's still feeding her child, who's 17 months old, and she was taking in a newborn for the price of £4 for the year to supplement her earnings. Now, there's various issues here, and mostly she didn't have the sustenance to sustain herself and her child, so it's very unlikely that she'd produce enough milk for the newborn. On top of that, milk supplies change over the course of the baby's life, so the milk that she was producing for her 17-month-old would not have been suited for a newborn. So there's lots of dynamics here, but it's showing us that breastfeeding, or babies' access to breast milk, was never straightforward during this period. And even though it was well known that breast was best, women weren't supported enough to actually do it. But this woman, as a wet nurse, wasn't unique. I've come across lots of examples of wet nursing. Wet nursing could occur privately, or it could occur once the workhouses were established in the 1838. It occurred in the institution. So if an abandoned child showed up or was brought to a workhouse, they were legally entitled to a wet nurse in the workhouse. But that was not always the case, logistically, if there were no recently delivered women there, and for various other reasons, that baby might not obtain a wet nurse. In the private field of wet nursing, and I've come across lots of different newspaper reports and adverts for wet nurses. If one wanted to be a wet nurse, they needed to have a recommendation from 2 local clergymen about their character, because milk at the time, morality was thought to pass through the wet nurse's milk, as well as diseases. I've come across one particular family, the Dalton families in 1820s Dublin. They were a wealthier family. The wife was writing letters to her husband while he was off traveling, and she spoke about her wet nurse and her doctor, Dr. Strange, who helped find the wet nurse. So during this time, the medical profession had a big role in helping you procure the wet nurse for your child if you were upper class. When a suitable candidate came along, the doctor would inspect the mother or the wet nurse, and if her baby was still alive, they would bring the baby in and examine the baby to see if the quality of milk was suitable for the wet nurse's new child that she'd be taking on board. So in these letters, Catherine Dalton talks about her trust in her doctor for finding her the wet nurse. And she talks about once the wet nurse is hired, that she used to send the wet nurse down to other families when their children were sick, because there was this idea that breast milk was medicinal. But on the flip side of that, we don't know much about their wet nurse or that wet nurse's child, but oftentimes the children of wet nurses missed out on maternal milk because their mother needs to go out and earn money. So just to round it back to this concept that we were talking about earlier, about is breast is best? Are modern women too lazy to breastfeed? I think breastfeeding has always been closely linked to work. Modern women struggle to breastfeed with pressures to return to work, whereas 19th century women struggled to breastfeed their own children because sometimes wet nursing was a form of work for them. So I think breastfeeding has never really been a straightforward practice, despite it always being considered the best for the baby. It's really important, and in the theme of this conference, to rewrite these narratives and to let new mothers know that it has never been a straightforward practice and that women often struggled, and that more support is probably needed for us to increase the rates of breastfeeding in Ireland. Thank you.